be presenting this topic about smartwatch detect arrhythmia, what to do. I'd like to start with this real case. Actually, this is my oldest brother. So he was having multiple episodes of palpitation, and I asked him to get a smart Apple Watch and see what's going on. So this is what he sent me early this year, and you can see it's showing atrial fibrillation. Did anybody have doubt on this? So he's medically free. He's going to the gym daily. He's in better shape than mine. So I asked him to do another ECG, and this is another ECG. So then I send him, you know what, go and get Belinda bucket, flecainide plus Concor, and let's see what happened. So this is his ECG after he got this medicine. It's back to normal. So I'll come back to him later, but what is the history about smartwatch and wearable devices? So back in 1989, this is when they start the PPG, which is photoplethysmography. And in this technique, they depend on the light that measure blood volume changes. You can see on the slide, it can get the microvasculature systolic and diastolic component, and with changing the amplitude, you can check if there is AFib or is sinus rhythm. The C, you can first see that there is atrial fibrillation, while the one down is sinus rhythm, and the one below is artifact. So after that, there is a plethora of devices that introduced into the market. This is from 2022. You can see there is ring, there is earlobes, there is chest band, there is even ECG badge. All of this, it's either depend on PPG or on 12-lead ECG, single lead ECG. The most popular one is the Alive Core, which I used to use it back in early 2000, and now the smartwatch, including Apple and the other one, which is Samsung. So this is the common smart wearable device, and their use, you can see it can be airband, it can be ECG patch or chest strap, and not only particular cardiology, you can use it even for COPD, for the oxygen saturation, you can use it for blood pressure, can even for glucose control. So these smart wearable devices is expanding, and I think at some point artificial intelligence, they will they don't need a physician to diagnose their case, because they will be able to diagnose themselves and just find a physician to treat them. So this is the studies that run from 2009 to 2019 for 10 years, and it showed that it has a good sensitivity and specificity, reaching from 84 to 97, depending on which slide, which ECG they use or which device they used. And not only that, they proved that in the SAFE trial, this was in 2007, that even it's better than a general practitioner reading a 12-lead ECG. So some of the general practitioners, they might miss AFib. And they found this smartwatch is better than general physician to detect AFib. So, and they went to study this. So this is the recommendation from the European Guideline to 2020. And they put it as class 1 level of evidence B for either 12-lead ECG or single-lead tracing of more than 30 seconds, showing irregularity as AFib. So they went to this study, which double-check AFib. They challenged these smart devices by doing taking patients with irregular rhythm, like patients with BVCs, premature ventricular contraction, or PACs, premature atrial contraction, and they put the device, and this is like not only single lead ECG, it's 6-lead ECG. So you can see there is outer surface electrode and also inner surface with a BBG, and they have to use it on their tummy to get the 12-lead ECG. So this is, you can see in the upper level, this is the BPG of the study, and the lower one is how it looks like, 6-lead ECG. and you can see it can detect clearly the AFib. So they took 344 patients. 121 had already diagnosed with AFib, and 95 sinus rhythm, 88 with BVCs, and 40 with BACs. And you can see the ECG is quite clear. The first ECG is AFib, sinus. This is with BVCs, and the other one with BACs. So accurate. So it's in the sensitivity of the BBG alone, it's reaching 96. With 6-lead ECG, it's 99. And if you combine both BBG and 6-lead ECG, it reached 99 sensitivity and specificity, up to 100% if you are using the AFib comparing to sinus rhythm. Not only that, you can see even in this one, this patient has typical flutter, and you can see how accurate to detect even the flutter. So the problem with devices, it's used by the young population, anxiety patient, and it might lead to multiple visits compared to where the elderly or the people at risk for AFib, they are, so this inherent paradox between the people they are using and the disease prevalence. So this is from Eurobase 2022. The guideline, if patient had prior stroke, you have to have some systematic screening for AFib. Or if there is no prior stroke, but they are at risk, like age-wise, more than 65 with comorbidity, you have to use the opportunistic, what you call it, opportunistic screening for AFib. If patient, if you can see here in the assessment comparing this ECG tool with the standard, which is Holter. Holter is like being there since 1957, and the help of the Holter is helping you if the patient has daily or weekly symptoms. But if it's monthly or yearly symptoms, good luck, like all the Holter are going to be normal. So in comparison to ILR, which is intracardiac monitoring device that we have to insert as minimal invasive procedure, it's only used mainly because it's expensive. It's mainly used for yearly symptoms that we don't know what's the palpitation from. But if you look to the single lead ECG or BBG-based device, you can use it in any of these episodes, daily, weekly, monthly, yearly. Because the good about it, it's symptom rhythm correlation. If the patient has the symptoms, he can get the 12-lead ECG, which not easy to do it with the Holter. So we'll go back to our patient. I sent him to our smart EP consultant, Dr. Yahya, and he underwent EP study and was found to have FNRT and was successfully ablated. So conclusion, overall digital devices of the heart rhythm monitoring are abundant. With the rapid advancement of technology, likely it will increase further, and I think at some point artificial intelligence will take over the diagnostic part at least. AFib is the most diagnosed arrhythmia in clinical practice. Estimated that 10 to 40% of incidence of AFib is asymptomatic. AFib-related stroke account for quarter of all stroke, and still often the first manifestation, unfortunately, of AFib. Wearable device can be reliable and accurate when employed in specific circumstances. Opportunistic screening for AFib by pulse tracking or ECG rhythm strip is recommended in patients more than 65 as a class 1. And thank you.